You've arrived in the hospital with your family member who's living with dementia. How ready are you to make life and death decisions? I'm Patrick Cawley, and this is Dementia Empowered. This is a podcast helping family members navigate dementia care, overcome legal and financial challenges, and make confident decisions for their loved one with dementia. Keep listening today, and you will hear about the importance of getting very clear on your family member's wishes for care and treatment in a medical context, always keeping in mind quality of life, how legal documents, medical orders, conversations that you have, and something called Medo can help form the plan for medical decision making. And finally, aspects of care that advancing dementia patients might experience where you are going to be called on to make some important decisions. My guest today is an experienced physician who has seen how it goes when family members are making medical decisions. He's also the chief executive and medical officer for a company called Medo, which you can find online at medohealth.com. That's like video spelled with an M, medohealth.com. His name is Dr. Fred Marari. Fred, thank you for joining me to share your experience and your insights with listeners of Dementia Empowered.
Thank you for having me, Patrick. And thank you for actually looking to encompass medicine into your law practice and so on, because it's a nice combination of things to have for people and to make sure they do everything correctly when they're setting things up.
I think it's essential. And I've said this on other episodes of the show, I don't think you can separate out care skills from the healthcare system or care skills from the legal or financial issues. It's really all coming together as part of the plan. And I am just thrilled to have your experience and insights to bring to the table for people so that they can understand something that I get through experience dealing with the healthcare system and with families, but you have been in the trenches. And I think this is so helpful. And some of this comes down to where are we on the dementia journey? So maybe early on, if a listener is thinking, I'm looking forward to the future where I might need to play more of a role in medical decision making, what should they be doing at that point? What does a trip to the hospital look like? Talk to me about that.
Yeah. So, like you said, right where they are in the journey, first and foremost, if people are at the early phase of the journey, look, there's still a lot of time and things to do and enjoyment left in life, right? As opposed to that end stage person with advanced dementia or advanced end stage dementia that is really bedbound and kind of near that end of life, so to speak. So it's really important, one, if you have a diagnosis of dementia, to do things quickly and get things established quickly and set up quickly. You need trusting people, you need trusted attorneys, you need trusted financial advisors, you need trusted medical teams, trusted social workers, caretakers, and people have a hard time finding that all themselves. So when you first get to the early diagnosis, it's time to plan. It's time to plan and really put things together so that when you start to advance into moderate and then later in your advanced and so on, that you have things in place and that your family has things in place, not to mention your healthcare power of attorney has things in place to actually take care of you with. And I think so many people hear the word dementia and just think end, that they forget everything leading up to it, right? Because again, we have lots of patients that have early diagnosis of dementia that are still fully functional and navigating the community and having a very fruitful quality of life.
And that should be the goal, of course. The trouble, of course, is that in the early stages, you have the sudden deterioration, or not so sudden, but if they're losing rational thinking, maybe some access to information in the past, memory issues, some of the key components of making decisions for ourselves. What we do every day, we're calling on information from the past to have context for right now. We are using rational thinking. So there's a supporting role for the family member and, of course, the treating physician, but people need to hold that person up where their skills are starting to go away. And I'm glad you mentioned the healthcare power of attorney. That is in every state in the United States. That's how you legally authorize another person to make your legally protected medical decisions. You have a right to say yes or no to treatment. Some of that's going to be weighing pros and cons of the risks or side effects, or what's the recovery going to look like, depending on what treatment we're talking about, versus the benefit you get from it. we all have a right to make decisions. And with the healthcare power of attorney, we're authorizing someone else to make the decision if we're not able. But that's not the end of the story for the plan, because of course there are medical orders that might come into play. So talk a little bit about that.
Sure. And again, I think the most important thing you said as far as the agent is very important. The agent is very important, whether you have dementia, whether you have heart disease, whether you're healthy. You really need to appoint an agent. Now, you also need to empower that agent. Okay. So you need to talk to that agent and talk to them about your wishes and give them the tools so that they can actually make decisions for you rather than have to guess what you think, what they think you wanted and so on. So it's really important there. Because as you especially in dementia now, as you advance with your dementia, when you lose capacity, they'll be looking to your agent, okay? So, maybe you're at a time when we need to start thinking about do not resuscitate orders, or maybe you're at a time when you need to start thinking about a post order or a pre-hospital DNR order. There's so many different things, and you really need to empower that agent with that ability. Because if they're guessing, then they're guessing on your wishes, and oftentimes they're gonna do what they think they wanna do for you rather than what you want them to do for you. So it becomes really important, especially when we get to the point of talking about these medical orders, like do not resuscitate orders and post orders, because quite often in medicine, those orders get created based off impressions of what the agent may say or what the documents may look like. And sometimes they're not always done correctly. And when they're not done correctly, you run the risk of harm to you. And nobody wants to see you run the risk of harm. So again, it's really important to empower that healthcare decision maker.
Them in empowering the decision making, obviously consistent with the title of this show, is what we're all about here. And I've spoken countless times to the adult child who was the caregiver for mom or dad, and dementia or no dementia, they're walking around for years second guessing what decision they made for mom or dad because they don't know. Did I say to the doctor, yes, put in place that DNR order or the post? Are we going to stop life extending treatment? Or did I cut life short? Or did I keep mom or dad around too long for more selfish reasons? And so being clear in your wishes is not just a matter of your wishes actually coming true. It's also taking care of the mind and emotional health of your loved ones. So I like how we've linked up. The agent is important. They have the legal authorities to make medical appointments, to speak to the physician and maybe make medical decisions, but they have to know what are they supposed to be doing for the person with advancing dementia. And I think a nice enhancement to all of this is why not hear it, if at all possible, straight from the mouth of the person with dementia. And of course, if this can be done early on, I think this could be a very important tool. So talk to me about Medio.
Oh, absolutely. I would love to. Video or my informed decision on video is you. It's basically a way to communicate. And it's so important for early stage dementia people to really be able to communicate for themselves because we lose that piece of the care scenario. We lose your ability to tell us what you want. And when it's dementia, whether it's dementia or whether it's anything else today, I really impress upon people to not depend on paper alone. Paper is good for the legal premises, but it's not good for the medical care premises that we have to have providers really think about what you want, right? So with Medio, we're actually able to take your wishes and really translate them into actionable medical orders that are understood by medical teams that actually mirror up with what you want. Okay. And that's really important because most people don't know this, but there's a lot of broken care there. We call it discordant medical care or a medical error, whatever you want to call it. But there's a lot of broken medical care that runs risk to you. And again, with dementia, it's really important because there are a lot of things now happening with dementia. And there are a lot of controversial things happening with dementia as far as people wanting things to happen to you that you may want or you may not want. There are some things that are happening today in the world of feedings with dementia, right? For late stage dementia patients, and whether or not we should be assisting them with feeding, or whether or not they made a decision to forego active feeding and so on. That's a pretty guilt ridden decision. If you ever seen that occur, I've seen it occur. And if you ever seen what patients go through with that, to leave it to an agent to decide is a very guilt ridden process for them. And it leaves a mark. It leaves a mark for years to come. Whereas with video today, you can actually see in the patient, see their reflection, see their tone in their voice, their ability to understand to what they're giving consent to or not to. So what we have patients that consent to voluntary stoppage of food and drink, And we have patients that want it and insist on having it. We have patients that want medical aid or medical assisted dying. We have patients that don't or are very actively against it. So again, it really comes down to that individual person, what they want, and utilizing video to enhance that decision making process for the agent, in addition to whatever documents they put in place.
Yeah, and having gone through the Medo process myself, I'm a card carrying Medo member. And of course, I'm in pretty good health at this point, but that's the whole point. If I'm ever not, if I can't speak for myself, as eventually is the case for the listener's family with dementia, wouldn't it be nice if they can call or pull a sort of an ID card right out of the wallet? It has the patient's picture on it. There's a QR code. They scan it, and up comes a video of me talking about what I would want. And I've been coached by you, Fred, or somebody else, a medically trained person who's going to look at relevant health history and is going to say, oh, well, this is the big concern that could come up. Let me explain. How is this going to go this way or this way? What would your choice be? What would your wishes be? And then with a nice script right on the screen, I just read what's on the screen. Now that video is in my account. So the people in the hospitals scan the QR code, up comes my video, even if I can't speak for myself anymore. And there I am speaking for myself. Very powerful way to augment, enhance what's on the page, because what you said is the first half of a healthcare power of attorney is just who's making my decisions. Who am I legally authorizing? Incredibly important. The second half is the living will, but we attorneys are stuck with language that comes from state legislatures where there very few of them are healthcare professionals, very few of them are lawyers. And they have, what does in the law aggressive care mean when you're in the emergency room, or heroic care? Well, it's all heroic care. We try to do a better job with, in my firm at least, making it as clear as possible. What did this person want? But inevitably, the language might not be what the way people in a hospital talk to each other. So you enhance all of that by just, you coach the person to put it in their own words so that in ways that the hospital will understand.
Yeah, and you made a great point. So I'm going to reflect right back to what you said at the beginning. You're young and healthy, right? You're young and healthy, and you did this, and you do it for a reason. And I have to assure people that medicine is not law. There's a reason why you're an attorney, and there's a reason why I'm a doctor, and it's not the same reason. So, like when doctors see medical documents, when nurses see medical or legal documents, when nurses see legal documents, when paramedics see legal documents, they have different understandings than what the attorneys had in creating those documents, right? All too often in medicine, we get people that come in with advanced directives or living wills, and the medical teams think, okay, this person has this document, so they're ready to die. And that's not often the case. The case is actually that they're coming for care. They're coming for medical care, and they don't have a good tool to really clarify what they want for their medical care other than this legalese piece of paper. And that's where we run into trouble in medicine. We need better tools. Think about it. Like it's the 21st century, right? And we're still like looking to paper to really tell us what a patient wants. And not just looking to paper, we're looking to paper that's based on legal jargon, right? Really the patient wants. And with Medio, we're able to bridge into that 21st century and really take technology now and take that patient and bring them back to the care scenario where that doctor, nurse, paramedic, family need to really hear from them to figure out what the right thing to do for them is. Because the last thing we want to do is be cookie cutter with this. If we do a cookie cutter mold and everyone thinks about this in a way that everybody should be treated the same, then we broke medicine further because we know humans are not cookie cutter.
No, nor should the legal planning be cookie cutter. And this is why, for dementia caregivers out there, I strongly recommend elder law attorneys, and I could guide you towards one in your state. But that's because you're getting it as close as possible on paper, still bound somewhat by what those legislators need to have in there as the legal trigger words, but you go beyond that to make it less cookie cutter. So true. But of course, a lot of this, Fred, it occurs to me, and tell me if I'm wrong, doesn't this kind of assume that the person who has either whether they have been diagnosed or whether they have not yet been diagnosed, but they're experiencing some cognitive decline, how can they speak for themselves in a reliable way on the video? So they go through Midio's process, the health histories out there in a confidential way with a healthcare professional, and they're okay. So these are the options. Which way would you go? And they're given the medical language to say into the camera. How reliable is this? And at what point
No.
can we no longer do that?
Yeah, no. So that's a great point in and of itself. So one, again, going back to the point of doing it as early as possible, right? From diagnosis, early stage diagnosis, best time to do it, and then to modify later on. So with dementia patients, when they're able to speak for themselves and we find that they have capacity and comprehension to speak for themselves, we use them. When they don't any longer, then we look to the agent because now again, they've appointed this person to really make medical decisions for them. So we take what they documented the first time, and then as they're progressing in their illness, we look to the agent again to modify when it's appropriate to modify. When we need to start really thinking about maybe slowing it down and de-escalating and talking about palliation rather than the full court press that we commonly do when we initially see people in medicine.
Okay, that makes a lot of sense. And so as things do progress with dementia, what are some of the health issues, if there are particular trends that you see where family members should be on, or they should be anticipating,
Oh,
maybe not on high alert, but what should they be anticipating as the dementia journey goes on?
yeah. So again, this kind of falls to the points of where they are in their phase, right? And then also what options are available for them for treatment. So it's not uncommon for me to see an early stage dementia patient who's got a heart attack and have people say, why are we treating that heart attack? Because they got dementia. Well, again, they're early stage, right? Now, that's a time to have a conversation. Say to them, look, you have an early stage diagnosis, or if you have a moderate stage diagnosis, if you don't treat this heart attack, it may progress faster towards the end for you. But if you do treat it, it will stabilize the situation. That's an individualized conversation. That's an individualized decision. Okay. Same thing when it comes to antibiotics. It's not uncommon for us to have a UTI be a terminal inciting event for a demented patient, whether a guy, girl, demented patient, UTI, they can get septic from it. There's treatment choices for it early on, right? So, but you have to have those conversations because when you look at the living will, it basically says yes, no to antibiotics. And most people, when they do a living will, and correct me if I'm wrong, but they usually check the check boxes no down the way because they're thinking in the way of a terminal end stage condition, persistent vegetative state. They're not thinking as early diagnosis dementia, moderate diagnosis dementia, and heck, even late stage dementia. There are people that would want antibiotics at late stage dementia. There are people who would not want antibiotics for late stage dementia. I can tell you what medical people think because medical people always think they shouldn't be providing things in late stages of things because that's where the push is going now in medicine. The push is really to kind of let things end. And quite frankly, again, that has to be an individualized decision because we don't want to be cookie cutter about it.
I can respond to that too, because I've had a number of healthcare professionals as clients, and they, more than anybody, go right down the list of
No, no, no.
individual, yeah, no, 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 to any sort of life prolonging treatment. I suppose because of the hours in the ICU or wherever else they've seen end stage conditions. But I think some of this comes down to good counseling and saying, let's not throw out something you might want just because of your understanding of it or misunderstanding of it. So we talk about when blood products might be used in certain conditions. We talk about how antibiotics, well, what about that sepsis? And I try to tell stories without using real names, of course. I say, well, here's a scenario, somebody with late stage dementia, but also type 2 diabetes. They have wounds that aren't healing. Bacteria gets in, in one way or another, they end up with sepsis. Well, in the late stage and a number of other complicated health issues, maybe that person would want the end to come quickly and
Right.
not treat sepsis, but they actually had a pulse where they said they wanted antibiotics so that sepsis has been treated twice. The UTI situation comes up in conversations when everybody's healthy and we're talking about it. But, I've had healthcare professionals as clients who say, look, if I'm end stage, which is when the living will comes into play, and that's really where that might be right there a problem that, well, you're going to get to end stage if we don't start treatment earlier. I think that's what you're saying. But the living will by the law only comes into play when, no, we're looking at a situation that can't be fixed. And that's where healthcare professionals look at the document the legal document and they say to me, well, at that point, you know, if I'm on hospice, they're probably giving me some high powered painkillers and I'm not going to feel a UTI and just let me go. But you're right. I think there is this inclination to just think the end and assume we're already there, as opposed to where if they came into your emergency room when you would see people there, I think they're not seeing that, well, maybe we're not there yet, but you're going to get there real quick if we don't do something. So it's thinking beyond just the end and what's the whole journey.
Yep, and again, that's why it comes down to having conversations with people that actually know what they're doing and so on, because again, I've been on both sides of this fence. I've had people that have had moderate dementia who decided to forgo antibiotics at a time when they got septic. I had end stage dementia patients who had received antibiotics because they weren't septic yet. And again, it comes down to individualized decisions, individualized discussions, and so on. And it's great to have the legal documents, right? But you need that voice of the patient to really tell you what they want, because the legal documents are not, they're legal documents. They're not medical documents, and they're not made for that medical interaction and so on.
Right. It's a good starting point, at least to authorize somebody, but indicating wishes and understanding the whole gamut of places where decisions will have to be made. You need more than that. And that's where Medo comes in. And I highly recommend that people go to medohealth.com. That's Medo, like video with an M, my informed decision on video. And you're going to medohealth.com. And I recommend the FAQ tab. So all the questions that people might be asking about, just tell me mechanically, how do I sign up for this? What would be involved? The website's outstanding and it really takes you through what to expect. But I think, Fred, you've really done a great job of explaining how the purpose of this is to enhance giving a voice to the patient as much as possible, as early as possible, so there's no ambiguity in what their wishes are. Where do we stop life prolonging treatment? Where do we keep going based on what that person wants?
Absolutely. Yeah,
Fred,
it's never an easy situation. So
yeah, yes. And all again, so it's not only the patient's wishes, but also the well-being of the family. And hopefully this all spurs some conversations of, especially later on, where it might not, you're recreating from memory. What did this person want? And that's all that matters. It's not what does the daughter or the son want. It's what did this person want? Even if we disagree with it, what did they want? So that's the goal. And we're just trying to talk about ways that you can get to that for the inevitable time where you're going to have to make some decisions.
and just remember, people have to remember too. Yeah, we always talk about this stuff in a way where it's towards the end. And again, I look back to what you said in the beginning. You're young and healthy. Look, we want to protect people, right? This is why this technology was built. It was to protect people's decisions to receive care and whatever their decision point in time to change, to look to start de-escalating care. It's not about a one size fits all, take you to the end type of approach. Our approach is to really look at people, look at their risk stratification, look at their disease process, look at their age, make recommendations, and essentially say, yeah, if this were my mother at this point in time, I would treat this in a heartbeat. Or, you know what, if this was my mother at this point in time, I wouldn't be doing this because it's just not the right thing to do for her. You know,
Well said. Fred, thank you so much for sharing your insights and experience with listeners on the show. This is, I
yeah.
hope, thought provoking. Caregiving for someone living with dementia is part care skills. It's part knowing how to navigate the healthcare system and legal issues. You can't separate these issues. And hopefully that's becoming clear to people. If you need guidance on dementia care skills, an important part of maintaining safety and quality of life while lowering stress, send me an email at info@keystoneelderlaw.com. I take people through a program to achieve those goals. Thanks for listening. See you next time.
Thank you.